Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Hi, everyone, and welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about the mental change. We will.
Hi, everyone, and welcome to Alzheimer's Speaks. I'm thrilled you're able to join us today. We're going to be talking about assisting Black families navigating the uncertainties and their fears associated with dementia. And this is such an important topic. I've had so many researchers on the show trying to reach out to this population and, struggling to get people to discuss or be part of research projects. So I cannot wait to introduce you to our guest. But in the meantime, I do want to remind people to please go check out alzheimersspeaks.com. That is our main website. There you will find one whole section that is just filled with free educational resources. There'll be videos, there'll be things you can read, there'll be audios, there'll be downloads, all kinds of stuff. So go to alzheimersspeaks.com and then also visit our sister company, which is Dementia Map. And that is a global resource directory. You can search within an area. You can search within pick from 150 different topics. You can read some great articles, check out the calendar of events, and so much more. And if you happen to have a service, product, or tool that you want added into Dementia Map, I would personally love to give you a tour. There's both free and fee profiles that you can get. And our goal is to connect people to services, products, and tools, make it nice and easy for everyone and affordable for everyone as well. That's absolutely critical, especially in this market. So with no further ado, let's introduce you to our guest. Well, Donna, I have been so excited to have you on this show. I think your topic is just so critical. As I've told our audience, I hear so many researchers talk about how important it is to pull the Black community into the discussion of dementia. And every culture is a little bit different. And so I'm really thrilled to have you here because, everybody needs help with this. But we have to do it in a way that's comfortable for them. And, there isn't a one size fits all with this. So I'm hoping that we can help in that process, raise awareness of the importance in terms of speaking to families about dementia and caregiving and how critical they are to us moving forward and doing a better job. So thanks for taking the time to be with us today.
Thanks for having me today.
Donna, can you introduce yourself? You can do a heck of a lot better job than I can.
Yes, my name is Donna Salaam, and I work for the Benjamin Rose Institute on Aging in Cleveland, Ohio, where I am in the research department.
And how long have you been with them?
I've been with Benjamin Rose about 2 years now.
Okay, great. Now, I always ask all of my guests if they've been personally touched by any form of dementia or cognitive decline in their own sphere of family or friends.
Yes, I am like many other Americans have been personally touched by dementia. My grandfather had dementia for over 20 years, and my mother-in-law also had dementia as well.
Oh, wow. Yeah, there's not that many that will say 20 years. My mom lived with it for 30. So I get that. And I remember the eyes rolling. Oh, there's no way she can live with it that long. And, we did the brain autopsy at the end. And Dr. Bill Fry, who's a neurologist here in Minnesota, he almost let out a squeak because her brain was so atrophied. He was just like shocked, and he's like, "Lori, you've always said she's had it this long. This proves it." And it showed that she had not only Alzheimer's but Parkinson's and Lewy body, which no one ever mentioned, during
Right.
your journey. And I want to mention this because a lot of times people think that dementia can just be a really short journey and end of life. And, if you go to Alzheimer's Speaks, to our free educational resources, we have one video under our Dementia Chats channel where we're interviewing people who have been living 15 and 20 years, and they're still doing Zoom. So there's a lot of good life that can be had if we choose to frame things a little bit differently. I believe, anyways, on that. So
No, there certainly is more than just receiving the diagnosis and thinking it's end of life. Like you said, when you think of someone who's had it 20 years or more, that's a long time, right? So you need to get things in place in order to, how do I deal with dementia and with someone for that long stretch of time? So I think it's so important to talk about and educate people on this topic, just because it is definitely not the end of life. It could be the rebirth of another 20 or 30 years that you mentioned.
when we touch base, what was the trigger for you to want to speak with me on the show?
Well, one of the things that I want to say, just in speaking with people in the community, is they have some of the same things that I thought initially. If I had known this, then I would have did that. So that's one thing that stands out quite a bit for me when it comes to talking to people about dementia and the project that I'm working on. A lot of stuff was just unknown. So being able to help people get a little ahead, be a little proactive, and get information that could be so valuable down the line.
Yeah, which is critical. And again, there's so many resources, products, and tools, support groups, things like Dementia Action Alliance that is primarily run almost by people with dementia. And they're doing podcasts and they're doing support groups and they're out there speaking and talking. And it's pretty incredible what is happening right now, and the purpose and the knowledge that both individuals and their care partners can be to others when they share their stories. They can really help out people tremendously on that. Now, you're working on a study. So who's involved in the study?
So we're working on a study of Benjamin Rose. Benjamin Rose realizes it's essential to get this information out to the Black American community. It's a program called SHARE, which was developed from Benjamin Rose after some research being done there. And this product, which is an evidence-based program, has been around for over 20 years. So, but this time what Benjamin Rose has decided is let's specifically focus on African Americans. So this project called SHARE is going to be focused on African Americans to bring, education, understanding, and light to the African American community and dementia, because African Americans are 2 times more likely to develop this than the other races. So it's huge in this community.
Absolutely. Now, is SHARE an acronym?
Yes. SHARE stands for Support, Health, Activities, Resources, and Education. And Benjamin Rose is out to give the family some free education. So may I mention this program is going to be a free offering to the African American community to help educate, empower, and engage these people or the communities and their families, the care partners, to do better so they can get the help they need proactively.
Okay, and I want to make sure I have that all. I have support, health, activities, and then I forgot the R. Was that
Resources.
resources?
Resource.
Okay, resources and education. Okay,
Yep,
wonderful. Um, yeah, it's so needed, and it's it saddens me to think that this has been out here for 20 years and just now it's being brought to the black communities out there. Again, when you say the likelihood of dementia hitting their families is massive.
it is. And so we want to change that narrative. And we want to get families comfortable with talking about dementia and other health related issues within the Black community because these are real. These are things that should be talked about. We're going to help educate them on what kind of dementia they have so they can feel better as they move forward with the information and make good choices so that you don't get in that position where everything becomes critical when you have to make those critical health decisions and you're not prepared, you're not ready, you do not know what resources are out there, and you just get stuck. So Share is going to offer families that free service in order to get this education to make great choices for that person. We want the person to be able to live, if they live for 20 more years or 30 more years, with dignity and respect, the same way that they were living before they knew that they had dementia.
Exactly. And I love that it's free, because this is a costly disease on
Yeah.
multiple levels, from money and time and just energy,
Yes.
in and of itself. Switching people kind of from a mindset to a heart set and busting through stigmas and trying to figure out what's true and accurate and what's not. I would actually love for Benjamin Rose to be part of Dementia Map, which is our global resource directory, to help spread that word as well, because it takes all of us together, and you never know who's going to trip over a resource and then maybe
Yes.
pass it on to a friend. I mean, I don't know about you, but I still believe in the power of word of mouth. I think that is the best resource out there, that because people trust one another more
Yes.
so than what they read. Everything is like, is this fake news or is this real? Does this pertain to me? I mean, life's gotten complicated out there with trying to sort all of this out, even though the internet has exploded and made it easier. It's in some ways it's gotten a lot more complicated too with all of that.
Yeah, so Benjamin Rose, the thing is, they are one of the nation's leading centers for applied aging research study. And they want to help change this. They want to help all communities, but right now they're specifically working on the Black community to get some of these numbers, to change some of the disparities that's out there, to again get them educated on something that's happening every single day. What we know is 65% of Black Americans know someone else who has dementia, right? But in the state of Ohio, 11% of older adults, 65 and older, have dementia. And that's higher than the national average. And in the county that I reside in, which is Calgary County, that number is even higher at 13.4%. So this is really real. This is out there. And the sad part is 24% of Americans that have dementia live alone. So they don't get opportunities like this. We want to change that. We want to say, hey, you don't have to walk this aging journey alone. You do not have to sit in your house with dementia and not share that with anybody. There's others out there that have the same diagnosis or something similar, and there's so much help out there. And Benjamin Rose wants to reach out to those who are interested. The great part is this is a national clinical research study. So anyone from anywhere can access this study for free. As long as they have access to some sort of a computer or tablet, they can participate in this program.
Oh, that's fantastic. And, taking that loneliness away and knowing that there are others, because like you said, so many people live alone. Everyone, I think, thinks that somebody has somebody, that's
Yes.
going to take care of them, and that, especially in this day and age, is not the way things work. There's a lot of people living alone in all different types of situations. I'm 66, and so when I grew up, I remember the first friend, and it was when I was in high school, who parents got divorced. That was unheard of. Everybody kind of was in a family situation.
Yeah.
And a lot of times, there was even grandparents and extended families and things like that. But that's not the way of the world anymore. And even family members and friends aren't always right next door where they can just stop on over. So things have changed greatly, and people need to know that this is a common entity throughout the world, rich or poor, black or white. It doesn't make any difference who
Doesn't make a
you
difference.
are. Dementia doesn't know any boundaries, and it doesn't care. And so we have to care enough to bring people together to support one another, because there's still a lot of good life left. Now, you said that people need access, let's say, to a computer. What can they expect if they participate in this study?
Okay, so let me share it first. We're really looking to recruit at least 120 families. So
Okay.
that's a person living with dementia and their care partner. And care partner, when we say care partner, we're referring to whether it's a child, a spouse, a neighbor, a friend. It could be anyone that's willing to help care plan. So with the development of this program, it's going to help families in the early to moderate stage. So we're looking for people with dementia in the early to moderate stage, because what we have learned is that this is the time when they are ready to engage and they're empowered to be involved in what their future looks like. So the participants will work with a trained counselor, and which is going to help them get through some very, very sensitive conversations, but also help them care plan for the future. And that's going to be very important, again, the early to moderate stage, because what we've learned is that's the best window of opportunity in order to get people. So that small window is super important in terms of getting the engagement needed for this program. But, the access to the computer or the tablet is going to be important because everything is going to be virtual. So no one's going to be coming out to their home. They're going to have access to this trained counsel virtually every week or every other week for up to an hour. And again, they're going to plan through 5 or 6 sessions where they figure out things that are most important to them. And what SHARE does is it also teaches the person who's the care partner how to balance best interests of both parties. So what we know is that the care partner is just as important as the person with dementia, because we want to make sure that there's a creation of self-care activities for them so that they don't get totally burnt out being the care provider. So SHARE's going to teach them how to balance both and make sure they're staying connected with people and they are sticking with some of their own hobbies, so to make sure that their mental health is in check. And in order to ensure mental health, we have to have contact, we have to do other things, and SHARE realizes all that. So all that's going to be going to empower both of them to do this care planning. And it's going to be a written document. So if they forget things, they need to go back. This is going to be a document that they're going to have access to, that they're actually creating with the counselor to help them as things continue to change with the dementia diagnosis.
Well, that's wonderful. People don't realize how important it is to self-care. And I think, and I know I ran into this myself in caring for my mom who lived with it for 30 years. I was kind of doing everything, but I didn't take care of myself, because I was too busy taking care of her and
Yes.
everything else, because you don't give anything up. But I never really looked at how important it was for her to still have her outlets as well.
Yes.
We were very protective, and part of that was, that's the way she wanted it, because she's been gone 10 years, and add another 30 onto that, life was very different. And people are a little more open to that, but every family and every person is going to be a little different on who they want to know. Like like their best friends didn't know, and I helped cover that up. And then I got mad at them when they, when they would do something goofy that would cause us a lot of problems. But it's because I wasn't honest with them. And
Yes.
so, how nice to be able to have that balance and that freedom, and someone to just kind of check you, because you get lost in it sometimes.
We really realize it's so important, whether you're 5 or 105, remaining active with hobbies and staying connected with others is critical in managing stress, enhancing your overall well-being, and remaining just physically healthy. And that's going to be important for that care provider, because in some cases they take on it all by themselves. They get overwhelmed. And we have cases where sometimes they pass away before the person living with dementia. So we don't want to do that. We don't want that to happen. So SHARE wants to help the family build a network of support and learn about the resources that are in their community so that they can access those as things continue to change. They know where to look, whether it's a support group or a program that's offered that we are able to share with them.
Caregivers sometimes getting sick if they don't care for themselves. And what I have found, Donna, is that's when, excuse my language, but kind of shit hits the fan, when all of a sudden the care partner is in the hospital because they had a heart attack or they fell, and it's like, I don't have a backup plan here. Because they're in denial of this whole process. And so it's good to be able to talk about those things, not scaring people, but just realizing these things happen way more often than you think, and you want to have a plan. You want to be in control. You don't want to be in the hospital trying to figure this out, right, or gone, and other people are figuring it out and really don't have a clue. So very, very important with that. The other thing, so I wanted to ask, in terms of this study, how you said it's weekly for about an hour to every other week, and I would imagine that'll vary depending on where they're at. Does this include people with MCI, mild cognitive impairment, or do they have to have a specific type of dementia diagnosis?
Well, no, the great part is you don't necessarily have to have the official diagnosis to participate in the program. As you know, oftentimes those around you realize that you may have things going on even when you don't admit it. So sometimes I've had people's children say, I know my mom has it or whatever. But yes, some of the diagnoses like mild cognitive impairment and Lewy body and other dementia types are all welcome. But we're also including people who have memory changes, cognitive changes, things that are very clear that there's something going on. We are, working with them as well. We want to help everybody that's going down this road, because it's like they're eventually getting there, and hopefully this program will have them talk to each other more in the household about how they're really feeling. I think that's the biggest thing, getting people learning how to communicate better about things that's going on so you can get the help you need. It's no need to suffer in silence. You need to take advantage of this opportunity, especially that they're offering through Benjamin Rose for the African American community, because it's a free program. And that's, quite frankly, we don't get much free. So, and at the end, those who participate will get a stipend. Both the person living with dementia as well as the care partner will be entitled to a stipend for their participation. So just let's break this down. They are going to get, and then receive. So what they're going to get is they're going to get services, information, a building a network of support and resources that is going to sustain them long after this program is over. They're going to be empowered, they're going to be educated, and learn how to engage with others around them in order to get their needs continually met. And at the end, they're going to end up with a stipend.
Little ching, ching, ching for those that don't know what a stipend is.
Get that money.
Yeah. Well, that's wonderful. Absolutely wonderful. Now, do you know how long the door is going to be open for you taking participants in?
Well, we are going to probably begin the clinical study at the end of July. So, and we'll be recruiting until the fall. So, but I would encourage anyone that's interested to reach out And so we can do some screening and see if they're fit and give information to them, whatever they would like. We are looking to help any of those interested. So we're not turning anyone away. It has nothing to do with income, location, or anything. We're helping any individual that's African American, 50 years or older, that have any changes in their memory, their cognitive thinking, or diagnosed with things like Alzheimer's or other dementia-related diseases like Lewy body or frontotemporal. Those are just to name a few of some dementia types, but we are willing to work with everyone, but you must be in the early to moderate stage, because we want to be able to have them sit down with their care partner and this trained counselor to map a great plan out as to how would we handle things as things change for me as a dementia person.
Okay.
Yes.
Well, that makes sense. I'm glad you confirmed that, because sometimes people will say, oh, I signed up and then I got all excited and then all of a sudden now I don't qualify. And so it's nice for them to know those things. And it's nice that you are open to people who don't have a formal diagnosis, because there's a lot of people that, you know, they don't trust their doctors, or they don't know what doctors to go to, or they don't have insurance, or they're just not comfortable getting that formal information, and to be able to still get the support and hopefully reduce some of the fears and empower them with resource tools and supportive services is absolutely massive.
Yeah.
So
because sure, that's the biggest thing here. We want to kind of take some of that anxiety and uncertainty that comes along with the dementia diagnosis and, work through that with the families. And so, yes, the SHARE program is going to break things down. They're going to be super patient. The thing about the weekly meetings, let me be clear on that. Those weekly meetings are designed with the counselor and the care partners and the care, the person living with dementia. So what will happen is once they meet, say they meet today on Tuesday at 1:00 for an hour, and they're not available next Tuesday at 1:00. They may decide they're available next Thursday at 1:00. Well, that's absolutely fine. They will design the times each week, which is nice. We're working trying to be as convenient as possible, because a lot of the care partners are still employed or they have families. So we want it to be a super flexible program for both, so that they can get absolutely everything that they need based on their schedule. We don't want anything to limit them being involved in this program. So it is going to be virtual and it's going to be flexible.
I love that. I love because sometimes things are so rigid and that just turns people off, and you're trying to tell people to live life, and then, you're not flexible to let them live life sometimes with this. And how long will the study last then? Is it a year or?
Okay, so the study is going to last up to 6 sessions. So if they go straight through, we're looking at 6 weeks. Okay. Other than if they go every other week, then, it'll be a little longer. They may go 2 weeks in a row and skip a week because maybe they don't feel well or something. So the option is, if they need to skip a week, that's okay. We're going to still work with them, but it's going to be 5 to 6 sessions. And the reason I mentioned the 5 to 6 sessions is because the 6th session is going to be optional to include other family members. And we would certainly encourage that, because the more support, the better. So if you can delegate responsibilities to more than one person, that helps that care partner, again, stay healthy and stay on top of their mental health, because they're not the only person responsible. So we strongly encourage that 6th session with everyone and hope that they take advantage of it.
Oh, I like that. And, because sometimes these research studies can be really long and people aren't sure that they really want to commit. And so this isn't a whole lot of time, but
it's short and sweet. And we're ensuring that you're going to walk away with something, including being able to sustain some of these supports and resources. That's the goal. So there's going to be short, but it's going to be very, very informative and very detailed. And it's like I said, they're going to walk away with physical things to refer back to, so that they know how and where to go, and they won't be stuck when critical times arise in their lives.
Oh, fantastic. Now, if you're just listening in right now, we are talking with Donna Salaam, who works with the Benjamin Rose Institute on Aging, which is a prominent research organization. And we've been discussing the SHARE program that is going to just be amazing in terms of giving support to Black families who are navigating the uncertainties and the fears associated with a dementia diagnosis. And the nice part is you don't have to even have that official diagnosis. It's a short participation filled with lots of great things that are going to help not only the person with dementia, but their care partner, and then wrapping up, being able to pull in other family members to kind of glean information and work into their specific role within this. You can reach the Benjamin Rose organization by just going to benrose.org. You can get a hold of Donna through her email. Email is D and last name is S as in Sam, A as in Apple, L as in Lori, and then double A's. And then M as in Mary at benrose.org. And do you want to give them a phone number?
Yes. So I can be reached at 216-373-1747. Again, that's 216-373-1747. And that's a direct number to my desk.
Now, I always like to kind of give a shout out to my webmaster because I just adore them. I know they're difficult to find. And Q for Good, they've just been a godsend to me. So I always like to pass on things that are working for me to others. They dumb it down so I don't have to know about the black hole. I don't want to know. I just want the black hole working, And they're very timely. They are very affordable and just kind and hold to their time frames, and they're amazing. So I just want to say, if you're looking for a webmaster, check out qforgood.com. They're wonderful. Now, I want to get back to Donna because I still have some more questions for you. Now, there's been a lot of talk about recent treatment advances, and, there's pros and cons about costs and times and effects. What do you have to say about where are we with dementia? Is there a cure out there?
There is no cure for dementia. And currently no cure for Alzheimer's disease and other dementia-related diseases. But in the meantime, it's so important that we continue to advance other ways to help people. So, and that means in order to provide relief, support, and hope to those that are affected. So we do not have the cure, but participating in such a program like this in the early stages, where you're able to sit down and design a plan for this program, is going to allow us to discover even more opportunities. So that's the critical thing about learning it early and getting involved in the early part. It helps the researchers work towards more of what is needed and what can be done to help people diagnosed with dementia.
Yeah, I love that you say about giving relief, support, and hope, because, my mom lived 30 years with dementia. And, people looked at me like I was crazy. They called me names, all kinds of stuff. No way could she live with it that long. And yet my mom lived a really good life for 27 of those 30 years. The last 3, she was in her final stages. She was on hospice and she popped off, and did really good again.
Yeah.
Things. But, it's really about our approach and our attitude that allow people to live well. And if we believe that there's no hope and there's no support and that people can't do things, I just think about, man, if somebody thought that about me, then I'm going to think that about me. And everyone's giving up. And, like the memory cafes are just like magical, where people come together and create these instant bonds because people get it. They're not judging, and they're making lifelong friends really in an instant, and people that they can tap into because they're not alone anymore. They don't feel alone. They feel respected. They feel heard. They feel understood, even though they know nobody can fix this, but they can support it.
We don't know, what everybody's going to need. The thing about being a caregiver is it can be a very rewarding experience for most people. Our caregivers feel a strong sense of pride. They're taking care of someone that they love. But happens, what coexists with that pride is also stress. So we got a positive experience, but there's also a high level of stress that goes along with that. And there's what we call a caregiver balancing act, right? So they're trying to balance their own lives. They're trying to balance and give the best care they can for the person living with dementia. And it's very difficult to juggle these things. They can't maintain, they're going to work, they're trying to maintain social relationships and just simply manage it all. But the biggest thing, like I mentioned before, is they have to learn to find things for themselves. We have to do self-care. What's also very good about things that's going on this day and age is telehealth, right? Because telehealth gives those, just like the virtual project that we're doing, other options for those who may be homebound or living in rural areas, get access to mental health that they may need or other services. And some programs, some dementia support programs, as you know, some of the groups are online. So the advancement of that is really important. We look at some people who are not they shy away from anything that has to do computer related, but those advancements are really helping, especially in this area as well, because some people don't want to share it. But if they have the opportunity to jump online and do a one-on-one, or like with the share program, work with someone specifically, they may be more inclined to do that. So I think that, changing and, Benjamin Rose making enhancements to the current share program to adjust and support the needs of African American is huge. This is monumentous because it's like they get a chance to privately talk to someone about something that's very public, but they don't want to share it. And they get the same opportunities as those who walk into a center and speak to a physician or a therapist, but they can get the same advice or even more participating virtually. So it doesn't limit them to the opportunity. So this is just a great opportunity for those in the community to take advantage of the advancements in technology and the supports that's out there for them.
Yeah, I love that. And, you can go to your doctor and you can talk to them about dementia or symptoms, but your doctor might not be trained.
That's right.
While you're talking with trained individuals that actually have resources, and the number one complaint that I hear from people all around the world is, I got my diagnosis, I got a medication, I got another appointment, and then they're telling me to walk out the door and get my affairs in order, and that's it. And they want resources, they want connections, they want hope, and they can see it in the doctor's eyes that
yes.
They don't have hope. And so you're going to be connecting with someone who has knowledge, who has hope, who understands all the range of emotions that you go through, and isn't going to look at you cockeyed like, you can't be mad, or you can't be depressed, or you can't. And both the patient and the care partner are going to go through those ranges of emotions. That's normal. Where we get in trouble is how we deal with it. And when we stuff it, that's when it comes out sideways, and we can have some problems. And so helping us get back to our relationships, and how do we still both continue to live as whole persons and meet our individual needs and care for one another. And I think so often, and I know this was a trap for me, is I made my to-do list, and then I ran my life by my to-do list. It was like, get out of my way, I got stuff to do. I didn't care about how I made anybody feel. I was just gonna get my list done. But really, life is about how we make one another feel, how we communicate, and that needs to be part of this. Otherwise, you get kind of hollow. And you don't want any disease to take away your relationships. It's an
No, those are super important. And the great thing about the shared counselors that we've recruited is they have either or both either taken care of a family member who has had dementia or are working in a setting. So most of them have one or both of those, along with the education of working with the older population. So we have some really, really experienced workers who are being trained to walk through this, to really hold your hand and make step-by-step processes and a plan to say, hey, this may be a good idea based on what you share with me. So they're not going to tell them what they're going to do. Together, they're going to develop this plan that's going to be long lasting and help that person, hopefully with dementia, feel at ease, and the care partner carry out some of the things, some of their wishes, the best of their ability. So when they're at the point where they have to make that critical decision, they don't have to feel bad, because guess what? They've already talked about it. They've had an opportunity to talk about things that are important to them and how they want to handle it. In 2022, the Alzheimer's Association reported that more than 44% of Americans were experiencing some kind of memory concern. But guess what? They didn't share with their own doctor. Why is that? Because the comfortability is something that you talked about. The doctors, maybe, I don't know if they knew or they made them feel comfortable, but they weren't sharing it. So we're saying, hey, if you have some of these concerns, come to the SHARE program. We'll walk you through. We'll guide you. We don't judge you. We don't turn you away and give you one little simple answer, because guess what? There's no simple answer to how this works, right? This is different from each and every one that has been, that has been exposed to dementia. Everyone is done differently. At Benjamin Rose, our motto is let's rethink aging. And why does they say that? Because they understand that a new approach needs to be taken for the aging process, and that families and individuals of the older population, everyone ages differently. So we have to take different approaches to finding services and support for these families. If 55% of Black Americans, knew that they were going through something, and guess what? They just didn't say anything. And that's not good. That's not good at all, especially seeing the amount of Black Americans that know someone with it, which is 65%. 55% said, oh, I'm going through old age. And we're kind of in denial. So with that, the fear, the stigma, the social attitudes, it's holding Black Americans back from getting the best care they can get, getting the proper diagnosis they need for this. And we want to put a stop to that. We want to change this narrative. And the great part about it is everyone in the Black community have an opportunity to participate in this groundbreaking research project. This is very exciting. I'm glad to be a part of such a great program, because this could change so many things for Black households.
Oh my gosh. Well, and I think too, sometimes people think if they've got any cognitive issues that they're going to be talked over, and they're part of this conversation. And that's one of the things I love that's changing in the industry is people are listening to people with dementia. Like, what is it really like? And what are your thoughts? How can we help you better? Instead of just automatically assuming that we've got it all figured out. Same with the care partners. Those were two voices even 10 years ago really weren't heard. I don't care what ethnicity you were. We were just all kind of run over. And that has changed because you guys have a lot of insights in terms of what you're truly dealing with. So never be ashamed of what you're dealing with, because it's new. But there are a lot of resources that can support you.
There are a lot of resources. And let me just mention that Benjamin Rose also has a very convenient resource. They have a convenient and effective telephone service for a dementia care. It's called We Care Because You Do. And that's people who are caring for loved ones. In our We Care department, we can assist anyone with finding quality services, whether it's, navigating dementia journey and challenges to other healthcare. So again, that's one of those things where we talked about the telehealth and the virtual stuff, the more opportunity that's out there. Benjamin Rose has many, many other programs, but that's one of the convenient programs they offer as well, so that people can access that. And for some people, that's how they're going to do it. They want everything to be private, and that's okay, but we want you to know what's out there and what's available.
Yeah. Is that a 24/7 hotline, or is that certain days?
No, they can call. If they don't get anyone, they could leave a message and they'll get back to them. But yes, they have someone available to reach out to them at all times regarding services and support. Like I said, if it's not at Benjamin Rose, which we have a hub of services. So for dementia and other healthcare, mental health, housing. So Benjamin Rose does quite a few things. But as far as dementia, we have several programs that you can access virtually as well.
Oh, I love that. I love that. Well, this has just been such a wonderful conversation. I appreciate your time. I appreciate Benjamin Rose really taking this to task and, trying to get people involved in this and easing the pain and the embarrassment and pulling them in and going, hey, you're one of many, and we're here to help. There's lots of support out there, and life doesn't have to be so scary if you let us in. So thank you so much, Donna. Donna can be reached via email at D, and her last name is SALAAM as in Mary at benrose.com. Phone number is 216-373-1747. And again, you can go to the Benjamin Rose Institute website at benrose.org. Again, thank you so much for your time today and your insights, Donna. I hope this helps many, many people.
Me too. Thanks so much for having me. I appreciate you.
Thank you. In wrapping up, I always like to ask our audience to be a giver of hope. Like, click, and share this episode. You don't know who's in your sphere of influence that needs this information, because a lot of people keep this tucked to their heart and they don't share it. And the more information we can spread into our communities, I don't care if it's Facebook or Twitter or LinkedIn, or you're talking to friends, share this information, because somebody knows somebody who needs this. And word of mouth is the best possible reference there is. And Benjamin Rose Institute has such an acclaimed background and backing in terms of the work that they do. And, they're there to help you. So let them. And in closing, I want to remind you to check out Alzheimer's Speaks for all of our free educational resources, as well as our sister company, DementiaMap.com. And you might also be interested in our book, Betty the Bald Chicken, Lessons in How to Care. It's a children's book that is tailored to get people to look at how we care for one another and get us to think about, how have we felt during our lives as adults? When have we felt like we didn't belong? This is a book that can be used not just for dementia and caregiving, but for any type of diagnosis, for addictions, for bullying. It's pretty much endless is the feedback that we've gotten. So feel free to check that out. And last and most important, be a giver of hope. Join us on sharing services, products, and tools with people in need. You don't know who in your sphere of influence is struggling, because a lot of times they just aren't ready to talk about it. So by liking and clicking and sharing, which costs you no money and very little time, you make a huge, huge impact on someone's life. Thanks again for being part of our community. See you next time.
Are you a senior looking for unbeatable benefits? Join AMAC today and enjoy discounts on insurance, travel, restaurants, and retail. Plus, get 6 issues of our award-winning AMAC magazine packed with trusted news and insights. AMAC stands strong in defending America's future, bringing the voices of over 2 million members to our elected officials. For a limited time, get a 1-year membership for just $1. Don't miss out. Join now at amac.us/join now. That's amac.us/join now.